I have done all of my training at UNMC. So I did medical school here, stayed for my pediatric residency, and then chose to stay for my fellowship. And the reason I chose to stay for all of that training was the people.
The first year of your fellowship will be very heavily clinically based, and in that year you'll have a number of rotations that will be on the inpatient service in the hospital. So whether that's at Children's Hospital Medical Center or if it's at the University of Nebraska Medical Center, you'll round on the inpatients. When new admissions come in, you'll be expected to be the first one who evaluates those new admissions. You'll be given the autonomy to figure out what additional orders or management decisions need to be made with those patients. So we're always there to help, but it's really, really important as a fellow that you're constantly taking that next step in the management decision with families.
Absolutely, I had excellent training. I really hit the ground running for fellowship. And then coming back, I feel like I've been very well supported as a brand new faculty member and have had opportunities from my training at UNMC and Children's to join national and international groups in my area of interest and to start a survivorship clinic from scratch, which was a big career goal of mine.
Omaha, I actually like to describe it to people as sort of a hidden gem. So it has all of the things you could want: great food, entertainment, sports, but it really has that smaller town community feel. People call it the 20-minute city, so you can get anywhere in the city in 20 minutes or less. And it just really sort of has that small town feel, but with all the big city amenities.
From a personal standpoint, we have a number of people who are invested in your education, and that's not just the faculty and the physicians. That goes to the nurse practitioners, the nurses, the case managers, the social workers, the educators. Everybody here is a part of a team, and every part of that team is incredibly critical, and the fellow is a critical part of that team. So you will be jumping into a team that sees you as a valuable member. We are, in all honesty, a young group of faculty, and we have a great deal of passion about working with our fellows. In that, we also know that we have more things that we can learn, and we can learn those things from fellows. We know that autonomy is important, and giving you autonomy and letting you understand where your comfort zone is. But outside of all of that, one of the wonderful things about this program for your career is the fact that it does have a freestanding private children's hospital, and it has a university academic system. Because when you finish your fellowship and we train you to go out there and be successful in your first job is either going to be at a children's hospital or an academic center or a place that's a combination of both. So by training at our site, you will have the best of both worlds to prepare you for the next step in your career.